All right. Welcome to those that are already here. Just give me a second. I'm going to get the presentation up and then we will get started. Sorry, once again, my computer doesn't have the best camera lighting, but
While you're getting that together, Cam, I just want to extend the welcome and thank everyone for being here. This is Mental Health Awareness Month, and we all know that mental health is very, very important. Um, so this is our way of um, just welcoming and honoring mental health awareness. We are having an event tomorrow, um, which we it's kind of been our annual field day event. We're having it at Highways to Hedges in Lenore, North Carolina. It's a free event for the family, and we're going to have some field day events, some a Zumba class. We're going to have a burn fitness event. We have some vendors that are coming, some that are just sharing informational stuff, and then we have some that are going to have things for sale. So we invite you all to come out and partake. This is going to be tomorrow from 11 a.m. to 4 p.m. In Lenore, North Carolina. And you can go on our website, I believe, and we have um, a flyer there so you can sign up. Um, and yeah, we look forward to you coming and being a part.
awesome. Yes, Corey, thank you for that. So that was Corinthia Harper, our executive director here at North Carolina Families United. And I actually have the flyer to share for our event later on in the presentation. So it's about 1:05. So I'm going to go ahead and get started. And my name is Cameron Lipford. I am the youth coordinator with North Carolina Families United. Just here to talk to you today about Mental Health Awareness Month, which is May, kind of what it is, how it came about, and how you can and we all can raise awareness and support others during this time. Oh well, my little clicker is not working. Okay, there we go. All right. So first off, what is Mental Health Awareness Month? Right. Um, Mental Health Awareness Month started back in 1949, over 70 years ago now. So imagine how important we think mental health is. It's been a topic of conversation for quite a long time at this point, but it's been recognized every May since then, thanks to the advocacy of Mental Health America. The green ribbon or the color green that you'll see throughout this month, or that you do see throughout the month, which I have a little bit of green on today, but this is for TBI awareness, but it still fits. um, it represents a symbol of renewal, hope, and healing. And this month is all about reducing stigma, educating the public, and promoting policies that support mental well being. And it's also a reminder that mental health affects all of us, regardless of age, background, or life circumstances. Of course, why it matters, right? We all have our own why, but the overarching thing is mental health is just important as physical health. Just as we prioritize checkups for our bodies, we should be doing the same for our minds. The reality is that 1 in 5 adults experience mental illness each year, and many more live with chronic stress, anxiety, or trauma. Talking openly about mental health helps normalize it, reduce stigma, and make it easier for people to seek help. When we intervene early, outcomes improve dramatically. So remember, conversations save lives. Just talk about it. That's all we have to do to start the conversation. One big highlight and something that we focus on here in North Carolina Families United is Children's Mental Health Awareness Week. It's always the first week of May. It just highlights the unique challenges that children and youth face. This year's theme from Mental Health America was Every Child Deserves Mental Wellness. 1 in 6 U.S. youth aged 6 to 17 experience a mental health disorder each year. And suicide is now the second leading cause of death for ages 10 to 14. Not only that, over 50% or more of all mental health conditions begin by the age of 14. So yeah, like we talked about, those numbers, they speak volumes. Mental health challenges often begin early. Like we said, half of all those challenges may start by the age of 14. And I'll be honest, at my age of 12 to 14, I really didn't even know what mental health was, um, where to go if I needed help, or if a friend of mine needed help. I really didn't know any of this information. And I would say that was back in, don't want to age myself too much, but like 2009, 10 at that time. Even though this has been around for 70 years, for me, I really didn't know about it. But just like we talked about in the last slide, the more we talk about it and take action, whether as parents, professionals, or peers, the more lives we can change. We must shift from crisis response to early prevention, education, and support. So the impact of stigma. Stigma can be one of the biggest barriers to seeking help, right? It creates shame and silence around mental health struggles, which only makes things worse. Think about how different things might be if people felt safe saying, I'm not okay. Stigma isolates, but compassion and understanding brings people closer. One conversation, one act of kindness, one open mind can break that chain. Our goal is to make mental health conversations as common and comfortable as talking about a cold. Just how we talked about our physical health is just important as our mental health and vice versa. So if we can talk about a cold, why can't we talk about being sad, right? So now I'm just going to show you guys some statistics based in North Carolina that have to do with mental health, and these may be things that are not so easily known. Just like the ones we've seen before, we understand that youth and adults both struggle with mental health and things like that, but these are some more specific details to kind of hit home how mental health is affecting North Carolina right now. All right, so this is just for you guys to take a look at while I talk, and I'll explain a little bit more about them. So the first one in North Carolina is emergency department overload. Atrium Health, based in Charlotte, reported a 65% increase in emergency department patients requiring psychiatric care. Notably, the demand for pediatric tripled during the COVID pandemic, and this was taken from 2023. And really, this just shows how the emergency room has become a last stop for mental health care, especially for children. A 65% jump in ER visits and pediatric cases tripling shows just how many families are in crisis and really have nowhere to go. This is their last stitch effort, right? We all know that emergency rooms are designed for acute care, not ongoing mental health treatment. These numbers highlight the urgent need for earlier community-based interventions such as school-based support, peer programs, and family education. So continuing on with the youth information, approximately 128,000 adolescents aged 12 to 17 in North Carolina have experienced depression. Alarmingly, over half of these youth did not receive any care in the past year. So, that's 1 in 5 North Carolina teens. This shows that even when young people are struggling, stigma, lack of access, and fear often stop them from getting help. As providers, educators, and advocates, we need to make sure our youth know that it's okay to ask for help and that mental health services are accessible, youth-friendly, and confidential. And just like for us, right, workforce shortages in mental health services. A staggering 94 out of 100 counties in North Carolina are designated as mental health professional shortage areas. That just blows my mind. But furthermore, 68 counties lack child and adolescent psychiatrists, highlighting significant gaps in youth and mental health services. So this is obviously a statewide crisis we are facing, right? Imagine living in a rural county, just like Caldwell County, where we're based out of, where there's not a single child psychiatrist. Families are forced to drive hours or go on wait lists or get no care at all. And that kind of goes back to the emergency department part, right? This is our last ditch effort because we don't even have service in our area. Some families may not even have a vehicle. Like there's just so many barriers to getting mental health support that it's just sad. But this isn't just a provider shortage, it's a healthy equity issue. We must support incentives to train, recruit, and retain mental health professionals in underserved areas, including telehealth and culturally competent care. Next is the prevalence of mental health conditions, right? An estimated 1,469,000 adults in North Carolina are living with a mental health condition. That's more than 3 times the population of Raleigh, our state's capital. That number is enormous. So just like it was the 1 in 5 teens, this is 1 in 5 adults that live in North Carolina with a diagnosable mental health condition. So I promise you, if you look around your dinner table tonight, one person may have a mental health condition, either diagnosed or undiagnosed, but you'll see that in your workplace, in your home, in your grocery store, all throughout your community. Um, and those are just the reported cases, like we said. The real number is likely higher, sadly, especially when you factor in people who haven't even been diagnosed or they're just too afraid to seek help. This reinforces that mental health is a mainstream issue, not something that only affects a few. So once again, we need policies, funding, and support systems that reflect the true scale and urgency of this challenge, right? And lastly, I thought what was important in North Carolina is in the recent year, 1,494 lives were lost to suicide in North Carolina, and 358,000 adults had thoughts of suicide, underscoring the critical need for accessible mental health resources. Um, if you think about it this way, I know it's first for us right now, but each of those 1,494 deaths by suicide is a family shattered, a life lost too soon, and thousands more that are struggling silently. We need to invest in prevention crisis lines like the 988, the peer support programs, and trauma-informed schools. But we also just need to create communities where people feel safe, seen, and supported long before they reach a breaking point, right? So those are just some things I wanted to leave with you guys about what our own state is going against right now when it comes to mental health. um, sorry, I keep forgetting that my clicker is not working. Next, I'm just going to share some overall statistics and things that are happening in America, just to show that North Carolina obviously is not alone in this fight against mental health. One thing I know we talk about it a lot, but just to harp on it, that adults aren't the only ones struggling. Nearly 1 in 2 LGBTQ plus youth struggle with suicidal thoughts, which is a heartbreaking reality, right? And these youth aren't inherently at higher risk because of their identity. It's because of how society responds to that identity, right? That stigma we talked about, discrimination, bullying, family rejection, and lack of support are major drivers when it comes to this. Same thing with Black and Latinx youth. They're half as likely to receive mental health services as a white youth, despite experiencing similar or even higher levels of need. This one I thought was really interesting, the loneliness epidemic. Loneliness is more than a feeling, right? It's a biological stressor that affects heart health, brain function, and life expectancy. Loneliness increases the risk of early death by 29%, similar to smoking 15 cigarettes a day. And, we all obviously have our own gripes and maybe habits and things like that we want to kick. But imagine, you look at somebody that smokes 15 cigarettes a day, honestly, you're like, ew, that's probably not good for them. But then you have a friend that says, oh, I'm lonely or I need a partner, I need this. And you're like, oh, I understand. Well, it'll be okay. And it's causing the same type of risk that it would smoking those 15 cigarettes. Once again, that's just something that blows my mind. But we often think of mental health only as anxiety or depression, but social disconnection is just as dangerous. And it's hitting our youth, seniors, and adults post-pandemic harder than ever. Workplace and mental health. 76% of US workers report at least one symptom of a mental health condition, and 81% of Gen Z employees have left jobs due to mental health reasons. Our programs, whether it's peer groups, family supports, or community outreaches, are about building real human connection, which is one of the most powerful forms of prevention, right? So same thing, whether you're in the workforce, you're at home, or you're part of a protected group, there are several things set in place that are definitely supposed to help with this, but the only way these things rolled out and recognized is continue to advocate for ourselves and those that we serve. Let's see, the youth mental health crisis, just like we talked about, ER visits for suicide attempts among adolescent girls increased by 50% during the pandemic. So 1 in 3 high school students reported poor mental health in 2021. That's a staggering increase. That 50% spike in suicide attempts among teen girls should be a wake up call for all of us, honestly. So, what are they telling us, right? That they feel overwhelmed, unseen, unsupported, and in pain. We need to make sure that these mental health services are available in schools, that educators and parents are trained to recognize warning signs, and teens have a safe outlet for connection and expression. When it comes to access gaps, there's more than 160 million Americans who live in areas with a shortage of mental health professionals. We just talked about 94 out of the 100 counties in North Carolina don't have adequate mental health professional staffing. And over 50% of adults with a mental illness receive no treatment. So that's nearly half the country without enough mental health providers. That's wild. And it's even worse in rural, low-income, and minority communities, as we've discussed. People are willing to ask for help, but when they do, they're put on a wait list for months or told there's no one in their area. That's not just frustrating, it can be deadly. And once again, this is why peer support, virtual services, and grassroots programs are so essential. We're filling the gaps that the traditional system can't yet. At least that's what we're trying to do, right? Just let me click next without having to do all this, but it doesn't. Okay, there we go. So now just some tips and tools for mental wellness. Talk about your feelings, right? Just speak up, like we said. Start a conversation. That's all you really have to do. Move your body daily, like we talked about. Physical health and mental health, really, they go hand in hand. Eat nourishing foods. Prioritize your rest, which is something I severely struggle with. Is trying to get sleep. But next is practice mindfulness and gratitude journaling. And then obviously reach out for help when you need it. So mental wellness doesn't mean never feeling sad or anxious, right? It's about learning to care for ourselves and having tools to cope. Encouraging things like those open conversations, right? We talked about the movement and the nutrition and the rest. These small daily habits build our mental muscles over time, just like our physical muscles. Our brain has muscle memory as well. And remember, it's okay to ask for help. That's strength, not weakness. So just a little bit about what North Carolina Families United does, right? Our main mission is to advocate for family-driven, youth-guided care, host youth support groups, peer-led safe spaces, offer trainings like rapid mental health first aid, provide community events to raise awareness, engage in policy and system change for better support. And that flyer may be a little hard to see right there, but that's the flyer for the event that we are having tomorrow, and it's on our website and everything else. Y'all just give me 1 second. I have to open this door for somebody. 1 second. All right. So yeah, sorry about that. Our the event we'll be having tomorrow, we said, is going to be great. It gives opportunity for youth and other community members to volunteer. We're working with a church. We have over about 150 people that are projected to come. This is, I think, our 4th or 5th annual event for mental health. We have bounce houses, like she said, food, old school outdoor games, and resources, and just connection. But outside of that, like we host our youth support groups, we have peer-led groups, we offer trainings like RAP and mental health first aid, and provide community events such as the one we have tomorrow, and then also engage in policy and system change by being involved with different work groups at the state level, local levels, national levels. I don't know why my camera turned itself off. Sorry about that, you guys. A little bit of difficulties. And so how can you help, right? Like we talked about, wear your green for May. I have my green on today, and we actually have some shirts for sale for Mental Health Awareness Month. You can look on our website and see about those. But you don't have to be a mental health professional to make a difference. Simply showing up, listening without judgment, and starting conversations can go a long way. You can help by wearing green this month to raise awareness, encouraging openness around emotions, supporting youth in your schools or neighborhoods, and sharing our events or content on social media. Every action helps build a culture where mental health is treated with dignity and care. And then next, I'm just going to share some resources for you guys to look at. Not going to talk too much about them because I'm sure you guys have heard of them, but some national resources. We have the 988 Suicide and Crisis Lifeline. It's an easy to remember number for emotional and mental health crises. It's available 24/7, 365. When someone calls or texts the 988, they're routed to the nearest local crisis center based on their area code. It's not just for people thinking about suicide, it's for any kind of mental health or substance use crisis. Same thing with the crisis text line, available 24/7 and responds in minutes. They're trained counselors that use active listening and collaborative problem solving to help texters move from a hot moment to a cool, calm moment. And then there's NAMI, the National Alliance on Mental Illness. It's the largest grassroots mental health organization in the United States. Offers free education programs, peer-led support groups, and advocacy trainings. They also have a hotline. It's not a crisis line, but it's a hotline. Great for getting information on symptoms, finding local providers, or learning how to support a loved one. And then SAMHSA, which we are funded through as well, the Substance Abuse and Mental Health Services Administration, is a federal agency. They also run a national helpline, funds local mental health and substance use programs. Their website offers treatment locators, mental health and addiction facts, resources, and it's a go-to for policy updates as well. Youth.gov has a mental health section, and it's managed by 20 plus federal agencies, provides strategies for supporting youth well-being, and the mental health section has prevention strategies, coping tools, and community-based approaches. So these are some of the national resources you can access or share with those that need it. Then next, here's just some local resources we have. So NCDHSA, DHHS, y'all, I can't talk. I can't say that word for some reason. Mental health, developmental disabilities, and substance use services. The federal agency, once again, they run it's a main state level agency that funds and oversees community mental health programs. They offer information from Medicaid, LMMCOs, and crisis stabilization programs. So NAMI is national, but we do have a cohort here in North Carolina. So they do the same thing that their national services do. Then obviously us here at North Carolina Families United, we're a nonprofit. We're youth and family driven. We support youth and families with mental health, behavioral health challenges, and we provide support groups, trainings, mentoring, and are involved in system and policy change. Then we have NC 211, a free and confidential information and referral line. It's operated by United Way of North Carolina. You just dial 211 or you can chat with them as well, and they'll connect you to the services that you need, especially for people who really don't know where to start. And then Hope for North Carolina helpline is designed to offer short-term emotional support during crises, free 24/7, and it's a valuable option. Lastly, we just have school-based mental health coordinators. Every North Carolina school district has a mental health point person or coordinator, and they're there to help the students access school-based therapists, individualized support plans, and referrals to outside providers. They're encouraged youth and families to start with their school counselor and ask about available services, especially if cost is a concern. Before I wrap everything up, I just wanted to stop right here and see if anybody had any questions or comments or anything like that. And then if not, I will wrap this up and hope everyone has a good evening.
I have something I just wanted to say.
First, you're breaking up a little bit.
Oh, I am? Okay. Is that better?
Yes.
Okay. I just wanted to, first of all, thank you, Cameron, for this information. This is a lot of information. Good thing about it is it's recorded. So you can go on our I think, is it YouTube that you can go and look at it later if you want to get some of
Yeah.
some of the information, and like write it down or whatever. Um, those resources will be captured there. But I just wanted to say, um, you know, North Carolina Families United, we're a small organization. We're a statewide organization. Um, the good thing about North Carolina Families United is we
It's
all,
still breaking up for me. It
it
might just be
is,
my connection though.
I hope not, I don't know. Um, the one thing I wanted to say is we all have lived experience, okay? Um, some people would look at that as a not so great thing. I personally feel like having lived experience, it allows us to have an edge because we all have been there in one one way or another. We have experienced mental health. When you have someone that has been there, that has been through it, they have a way of being able to show empathy like no one else can. um, I I suffer from depression, anxiety, ADHD. I have a TBI. Um, it's hard to get out of bed sometimes. Okay, just being real. It's hard to get out of bed. And some days when I get out of bed, it's hard to put one foot in front of the other. Um, but when I have people around me that I know are going through the same thing or similar things, it helps. So, you know, we are here, and if you need someone to talk to, if you need someone to sit in silence with you, we may not know the answer right off the top of our head, um, but we can try, you know. um, I encourage you to find someone, anyone to talk to if you are going through mental health, if you are going through depression or you're feeling alone. um, there's not one, what am I trying to say, it's not one hurt or frustration or diagnosis that's bigger than the other. So the main thing is, don't sit in silence. Don't feel like it will just go away. You have to make the first step. You have to allow people in to be able to help you. um, so I encourage you to do that. Okay. We don't have all the answers, but we will try our very best to connect you to resources that are available in your area. The other thing I wanted to say is we welcome ideas. If you can think of something that you think, man, this would be great if we had someone to do this, or it may be something that no one's ever thought about. And then again, it could be something that people have thought about, that you just don't know about it. So we welcome, and there's not an idea that's too small. There may be some that's too big, and in that case, we're going to require you to help us with it because, like I said, we're a small agency, but we will do our very best to help. Okay, um, and I know that today is May. What is today? 29th or 30th? 30th. Today's May 30th, and you may be saying, "Oh, it's at the end of the month." Well, guess what? Mental health awareness lasts all year round. All it takes is for you to be aware. Okay? Be aware. And if there is something that you need, something that you want, something that you desire, something that you don't know about, give us a shout. We will try our best to do our due diligence to help in any kind of way, shape, or form. Okay? We appreciate your time and effort. I'm going to turn it back over to Cam. This is just something we are very, very passionate about. One of the programs that Cam did not mention is STAR. That is a program that we have. It stands for Start Talking About Rebuilding Relationships, and we are working with incarcerated parents and their children, and trying to reconnect and rebuild that bond. When you're away from someone for a significant amount of time, relationships tend to kind of fall through the cracks. So we have just started this program, and we are working with Wilkes and the Caldwell facilities. We will actually go into the facilities, God willing, in October. But even with that, we're always open to suggestions and um, things that you think might be a good idea. So please, contact us. Go to our website and, you know, give us a shout. If you think of something, if you want to be a part in any kind of way, we're always willing to, we love volunteers. We love volunteers. So if there's something that you feel like you would like to help with us in that, we would be glad to speak with you about it. All right. Thank you so much. Thank you all for being here today.
Yeah, I'm sorry about that. My connection is not too well. So you're like cutting it out. It's like kicked me off once. So if I missed anything, I do apologize. Okay, and it just tried to do it again, actually. So I'm gonna say my last little spill and let you guys go. Um, okay, sorry about that. Just don't have the best internet. So lastly, I just want to leave you with this. And Corey, once again, thank you for your help and just sharing. I didn't see anything in the Q&A, so I just want to say mental health is health. You are not alone. Let's break the silence and the stigma and build a stronger, healthier community together. And then this is right here where you can just contact us, our phone number, our email address, and our website, as well as follow us on social media. I just want to say thank you. You guys have a great evening. If you can make it to our event tomorrow, that'd be great. Um, and then also we have a webinar for next month. If you guys want to sign up for that. Thank you so much. Sorry for all the technical difficulties.
Good job, Cam. Thank you.
All right. Thank you.